Hello, my name is Ariana DeAngelis, and I'm the training manager for the Autism Project.
And I'm DJ Chase. I'm a student here at NECO, and I'm the digital accessibility specialist. I'm also autistic.
Today, we are going to introduce the topic of autism. According to the CDC, 1 in 36 children, as of March 2024, when we're filming this, is diagnosed with autism. But autism does not just apply to children. Autism is lifelong, and you're going to encounter autistic students frequently throughout your career.
By learning the signs and characteristics of autism, we can respond using the tools and strategies we'll be talking about today. These tools and strategies can help to de-escalate a situation and can also improve the experience for the autistic person.
Definitely. To quickly summarize, autistic people may socialize, communicate, regulate, and respond differently to stress or anxiety than their neurotypical peers. For example, students who communicate verbally could potentially lose that ability to speak just during periods of high stress. So, on an average day, that student may have no trouble communicating at all, but then when you as a public safety officer are interacting with them during those difficult moments, they may not be able to engage.
You might also encounter someone who can speak, but has difficulty processing what is being said to them. They may agree to everything that you are saying, but potentially do not know in that moment what they are agreeing to. Or they lack the verbal language to say anything other than yes in that moment, because of stress or anxiety. You could say, "Are you drunk?" to that person, and they may say yes, even though they are sober.
And this applies to understanding of verbal commands too. If you tell the person to stand up, they may remain seated, not because they're challenging your authority or trying to get into a power struggle, but because in that high stress situation, they aren't able to process verbal language or follow commands. It's not that they won't do what you're saying, it's that they can't.
Autistic people have challenges or differences with nonverbal communication as well. When we talk about nonverbal communication, we mean body language, tone, and the volume of one's voice. Part of the body language that we use day to day is our facial expressions. Neurotypical people associate smiling with being happy, frowning with being sad or frustrated, etc. But many autistic people have difficulty controlling their facial expressions in periods of high stress or discomfort. You may encounter an autistic person who is extremely anxious or frightened, but is smiling, smirking, or laughing.
So, thinking about what we just talked about, imagine you as a public safety officer are pulling someone over for speeding on campus. You ask them if they know how fast they're going. We talked about how in some autistic people, in periods of high stress, they may have difficulty with verbal and nonverbal communication. So you may say, "Do you know how fast you were going?" And the person says nothing and smiles at you. If you don't know any better, you're going to think that they are disrespecting you or trying to get into a power struggle. In truth, they're anxious or scared.
And the same goes for medical emergency. You might have someone that is in a lot of pain and is expressing that pain by laughing. Do not think that autistic patient or victim is okay simply because their body language suggests that they are.
Absolutely. And one thing I'd like to add to the discussion on nonverbal communication is eye contact. Many of you have likely heard that eye contact can be challenging or even impossible for some people. Please do not force eye contact. Do not demand that the person look at you while you are speaking to them. It may actually escalate the person, make them more anxious, or even make it difficult for them to focus on what you're saying because they're putting all of their focus into staring into your eyes.
At the same time, there may be other autistic people who feel that they should maintain direct eye contact with you at all times and lock eyes with you for the duration of the encounter. Again, this might look like an attempt to challenge you. In truth, the person may feel like they are fulfilling a social expectation by not breaking eye contact.
Absolutely. And just a few more key points about communication. We also need to think about how fast we talk and how often we repeat ourselves. Many people require extra processing time to understand verbal directions or information. Even asking a question like, "What is your name?" If the person doesn't answer right away, give them 15, 20, for some folks even 30 seconds to answer you before asking again. Don't say, "What's your name? What's your name? Hello, what is your name?" over and over again, because it may make it difficult for the person to respond.
If you have a whiteboard or a piece of paper, you can also try writing the question down. That person may be able to read what you have written and then answer verbally, or may be able to write an answer.
Another characteristic within this category is repetitive speech and movement. So repetitive speech is called echolalia. The autistic person may repeat lines from movies or TV shows, or may repeat what you have said back to them.
So if you have to say to them, "Have you been drinking?" they may say, "Have you been drinking?" back to you. It's not an attempt to mock you. Rather, it's echolalia.
Absolutely. And the repetitive movements I referenced earlier are called stimming, or self-stimulatory behavior. You may encounter people who snap their fingers, flap their hands, rock, jump up and down, or walk on their tiptoes.
They may also use different tools to stim. Even something like a string, rubber band, ribbon, fidget spinner, or a squishy toy may be used by the autistic person. What's important to note here is that, unless it is unsafe to have, please do not take away any of these tools from the person. They are using these tools to keep calm, and removing them could escalate the situation.
Definitely. And these tools or fidgets are a good way of kind of segueing into a little bit of a topic about sensory. Many autistic or neurodivergent people are, as we talked about in our other videos, over or under responsive to sensory input. These tools can be a great way of managing during those periods of overwhelm. Students may be over responsive to things like loud noises or bright lights. If you know there's an autistic person at the scene, try to arrive with your lights and sirens off.
In addition to the obvious lights and sounds, shiny things like badges and sunglasses might be distracting. The noise from your radio might be agitating as well. Try to reduce sensory stimulation as much as possible.
Using sensory tools and strategies and avoiding overwhelming sensory input can help a person to stay regulated. Another thing that helps a person with their regulation is predictability and routine. Unfortunately, routine and predictability is often disrupted by an interaction with public safety. For example, let's go back to the scenario where you are pulling a student over for speeding on campus. That student's routine may be they leave class, they stop at the vending machine, get some potato chips, and then they drive back home. On this day, you catch them speeding and attempt to pull them over. But the routine is to drive straight home. So the person may drive all the way home before thinking to stop for the officer. They are not attempting to escape the officer, but actually just following their routine.
Another thing to know about autistic people is that they often have areas of high interest called special interests.
Yeah.
You will likely encounter autistic people who have a high interest in a particular area or areas. These interests could be anything, from cartoon characters to shows and movies, to maps, transportation systems, space, dinosaurs, art, and engineering. If you can, learn what the person's interest is. You may be able to calm them by talking about it.
Absolutely. That is a great tip, DJ. And here are just a few more. First, in any interaction that you're having with a student, try to make the experience as predictable as you possibly can. Consider using something like a first-then board to walk the student through what's going to happen now and then what will happen next. A first-then board is just taking a piece of paper, a whiteboard, any sort of a visual, and writing down what is happening first and what will happen directly after. We're trying to bring as much predictability as we can to a really unpredictable situation. So here's an example of a first-then board. First, sit down on the bench for 5 minutes, then answer questions on the whiteboard. The person has a visual of the expectations and knows that the interaction with public safety will begin with a 5-minute pause to regulate, if that's appropriate to the situation. If possible, a checklist of steps could also be very helpful. Instead of a first-then board, write the steps down on the whiteboard and cross them off as you go.
And with that 5-minute break, you might want to give them a 2 and a 1-minute warning before the break ends, or show them a timer on your phone so they can keep track of their break. Also consider that if you have to provide directives to the student, always frame them using positive language. In other words, don't say, "Don't hit your head." Instead say, "Have safe hands."
DJ, you just highlighted how important it is to use simple language. You're not saying, hey, I see that you're hitting your head, and that probably really hurts, and you should stop and maybe have some safe hands, put your hands down. Your directions are short and to the point. It's important to decrease the language that you're using. And if you have to use language, be as calm, supportive, and reassuring as possible. If the person is melting down, move dangerous objects away from the person and give them the space to calm down if it's safe to do so. And check out our other video supporting students during a meltdown for more information.
We've been over a lot of information and scenarios in today's video, but here are some key takeaways. Do not demand eye contact. Give the person 30 seconds to answer a question before repeating it. If they still don't answer, try writing it down. Do not take a person's fidget tool from them. Minimize sensory input. Avoid using lights and sirens. Make the situation as predictable as possible.
Learn the person's interest and, if they are willing, speak to them about it. Use visuals like a first-then board or checklist. If taking a break, set a timer or count them down so they can anticipate when the break ends. Use positive, simple language. Remain calm and supportive. If the person is melting down, move any dangerous objects away from the person and provide them with personal space as long as it is safe to do so.
The more we learn about autism and neurodiversity, the better equipped we are to support students on campus. By following these tips, public safety officers will prioritize de-escalation, which is a huge support for neurodivergent students. We sincerely thank you for taking the time to learn these strategies.
A truly neuro-inclusive campus is achieved by taking steps like this. We are coming together to learn, to support, and to celebrate our students of all neurotypes. We thank you.